So my name is Madeline Neff. I'm a second year DO and PH student, and I chose to go to HSC because I love the community that this school has fostered for its students and staff alike. Right, I think they complement each other really well, actually. I wish that more of our medical curriculum incorporated public health principles because I think that healthcare should be more well-rounded. And so it's been really interesting to learn about more like insurance and like policy and how physicians have to dictate their healthcare based off of those things. And so learning more about it means that I can advocate for policy in the future and have more control over my practice. Yeah, so it's really cool to learn about the other professions because we're so siloed in our own individual schools that we don't really get to learn about people that we'll work with in the future. So I really appreciate the opportunity to just get to speak with them. And it's interesting because there are a lot more similarities than differences, I think, which will make the transition of working in a group in a clinical setting easier, in my opinion. So I think the only real experience I have with this would be SAGE, which is where we work interprofessionally. So like my group was a pharmacy student, a nursing student, and then 2 medical students. And we care for an elderly person in the community. And I think just having different backgrounds slightly made it a little bit difficult because each of us had different expectations of how the visits were going to go. But once we kind of got used to each other's like thought processes, we could work together and really plan beforehand. And then we kind of fell into our roles and like respected each other's opinions and thoughts. Has been our baby. So we started it in December of 2023, and we've put a lot of passion and heart and soul into this. I think one of the biggest things that I have appreciated from this organization is all of the different relationships that I've gotten to foster. I mean, from students and staff alike, from the School of Public Health, School of Pharmacy, like it also is kind of a way to have interprofessionalism. And it's just opened up so many relationships and just even volunteer opportunities within the community. So we do a lot of work with Cuisine for Healing and the Joan Katz Cancer Resource Center, and those things have just been so enriching. Absolutely. So I think they just really encourage us to talk to each other as people, to kind of put those titles aside, I guess, of whatever student you are, and just relate to each other on a very like basic level. Like, we are people, and to make space for emotions and things of that nature. And if you have that foundation, then you can build from that and you can have a really successful team. Both of them do a great job of focusing on mental health because no matter what health profession you're in, it's very stressful, it's very time crunched, but both Be Well and HSC really emphasize the importance of taking time to be with family, to enjoy your hobbies, to make sure that you're okay so that you can provide as best care as you can to patients.